Hello, my name's Jason and I'm an advanced nurse practitioner working for Medvivo. I've worked for Medvivo like 5.5 years and I really enjoy the job and the challenge it brings.
My name's Debbie. I'm one of the nurse practitioners who works for Medvivo. My background has been almost exclusively, until I came to work with Medvivo, secondary care. I did a few shifts in the out of hours for Medvivo alongside my secondary care work and absolutely loved it.
I came across to Medvivo around 8 years ago and I've had various roles within Medvivo in that time, and during that time I've had extensive training and I've had a lot of investment put in me.
The good thing about working for Medvivo is the variety it brings. There's different shift types. You can be working in a base in face-to-face patients. You could be doing triage over the phone, closing cases or bringing them in. You could be out doing mobile home visits.
So I've just arrived for my mobile shift at Swindon. Mobile shift is exactly what it says on the box. So I have got my driver who's very kindly filling the car up and making sure that everything we need for the next few hours is in there. And it involves doing home visits, going out to care homes, and seeing patients who can't come to clinic centres for face-to-face appointments.
So we deal with anything from children all the way up to end-of-life care. We've also just opened video consultations, which are a real string to a bow actually, because you can then see the patients. So I think as nurses we're always taught that a lot of it is about us viewing things and then making the assessment, so that's really helped. I tend to do telephone triage, video consultations and face-to-face appointments, and I enjoy them all. It's something I love, and I've loved doing this for a very long time.
We have an excellent intranet site which is really well managed, and on that we have bi-weekly what we call clinical digest, but that's the latest clinical updates that go in there for all clinicians. 3 times a year there are nurse practitioner study days arranged, where we have a range of guest speakers, and we've had people in the past from palliative care backgrounds, mental health, paediatrics, surgical, and they're really, really good days.
There is always somebody you can talk to, always somebody who will offer advice, always somebody that will help you if you're uncertain about where to go with the patient or how best to proceed or what's in the patient's best interests. And that to me is incredibly important. And certainly when I first started working for Medvivo, it was absolutely invaluable as I was finding my feet.
So I have 3 children, and actually the hours that I'm able to work have been really flexible, and especially in the time of COVID I've been able to sort of work in various places. So for me that's a massive factor. I do have a balance, a work-life balance.
Key to being successful as a nurse practitioner with Medvivo is essentially, I think you must have the willingness to learn and develop. You need to be able to work autonomously and be comfortable with making clinical decisions autonomously, although there is support if you need it.
The support and training and help I've received since I've been working at Medvivo has just been second to none. They have looked after me, they have ensured that I've had whatever training I need. They have, whether it's a one-to-one or on study days, I've always been given as much support as I needed to make sure I could do my job safely and effectively.
To learn so much, and also appreciate the fact there'll always be someone there who knows more about something and someone who also needs a bit of teaching, and that's really nice.